Good evening. I'm Dr. Beams, and tonight I'm going to tell you about a tool for preventing anxiety and depression in kids. It's called Rubix. I've been caring for families in Howard County for over a decade, but over the past 5 years, I've seen a steep increase in mental health needs. Today, 60% of students report anxiety and depression. 1 in 8 teens say they've considered self-harm or even suicide. I've been a pediatrician for over 15 years, but in the past decade, I've seen changes in the way kids live. Specific changes are contributing to anxiety and depression. For example, kids are not getting enough sleep. They're socially isolated, and they don't get enough time outside. They've got a sense of hopelessness about the future. And there are too many hurdles between our kids and mental health care. By the time they share their concerns, if they share their concerns, they've usually been suffering for months. Then it's going to take weeks for them to get an appointment with a provider who usually doesn't take their insurance. But our kids can't wait anymore. Last winter, when a kid in my community died from suicide, I had to take action. So I reached out to a respected counselor and asked her to help me identify the root causes of depression and anxiety before they take hold. So together, we produced a preventive tool for identifying those causes. This tool uses 6 areas of wellness to evaluate your mental health and try to prevent anxiety and depression before they take place. Those are physical, social, emotional, environmental, professional, and intellectual. We use a 40-year-old system called a wellness wheel to evaluate these categories, and then we use that information from that inventory to identify strategies to prevent anxiety and depression. So since most of you haven't seen anything like this before, I'm actually going to have you do part of a wellness wheel tonight. So in your program, you should have a piece of paper with a partly colored wheel in it. Go ahead and take that out and grab a crayon from the cups on your table. All right, cool. So if you get 3 hours of vigorous physical exercise every week, color in one of those pie pieces all the way. If you get a little bit less than that, color in that pie piece a little bit less. All right, now similarly, if you spend 3 hours a week outside in nature, color in that last pie piece. And if you get a little bit less than 3 hours a week in nature, color it in just part of the way. Now on the back of your card, you can actually see suggestions for interventions to improve in the areas of physical and environmental wellness. And by answering 10 questions in each of those categories, you can get an idea of where you are with your wellness in each of those categories and then begin to create preventive strategies to improve on challenged areas and maintain your strengths. In fact, in our 8-week pilot program, participants experienced a 20% improvement in their wellness score. But our program doesn't replace providers or therapy. In fact, what it does is it helps you prevent anxiety and depression before they take root. And my big idea is that we shouldn't be waiting for kids to be depressed or anxious or consider suicide. We should be addressing these problems before they begin. And every child should have access to this kind of training, not just those who have insurance, not just those who have time to get to therapy, not just those who have the courage to speak up, but all of us. So we've partnered with Grassroots Crisis Intervention to bring the program to their kids in the county and then eventually bring this program to every child in the county and nationwide. We know our program helps, and our kids can't wait another day. Let's put Rubix to work for our county, for our kids, and for our brightest future.